So, welcome to the next session of the General Medicine, General Surgery series. So, in succession to the previous topic of about the burns, what I have discussed, moving on to the next important criteria. The next very important topic for burns is the complications related to burn. So, students out there, basically today I'll be focusing upon the important multiple choice questions, the important frequently asked questions, particularly the one-liners, what are very frequently asked in the various PG entrance examinations. So students, the complications of the burns can be categorized, can be summarized in the forms of different types. So the one-liners or the most frequently asked questions, what are there? Just beginning with, when talking of the thermal burns, the first, all the points I have summarized over here. So the first point, what are being very frequently asked in the various PG entrance examinations is first, that is the thermal burns. So the thermal burns, it is basically a kind of a coagulative necrosis. So in the previous videos, I have already talked about as to what are the clinical features of coagulative necrosis. So since the burn, it is an injury to the skin, which can occur due to thermal, electrical, chemicals, radiations. So when talking of the thermal burns, it is a type of coagulative necrosis, and coagulative necrosis, as we all already know, that coagulative necrosis mostly occurs in such conditions or cases whenever there occurs an ischemia, that is a decreased supply to any particular body or an organ. If it is there, then the type of necrosis what is seen, it is the coagulative necrosis. So in cases of burns, if it is a thermal burns, that is the thermal burns what are being inflicted by either flames or dry heat or moist heat or scars, whatever are there, if it is a thermal burn, the type of necrosis what occurs, it is the coagulative necrosis, which occurs due to ischemia to the particular organ. So the first frequently asked questions, what is there, it is as to what is the type of necrosis which occurs in cases of thermal burns. Moving on to the next very important complication of the burns, it is the hypovolemic shock. So students out there, do remember that in most of the PG entrance examinations or the NEET examinations what are being conducted for the PG entrance, they mostly ask you as to what is the most common cause of early death in a burn patient. So students, do remember, it is the hypovolemic shock. That is the hypovolemic shock. It is the basic cause, it is the most common cause of early death in a burn patient. So the patients who are having they suffer from hypovolemic shock. So in hypovolemic shock, just look at just a short explanation as to how the hypovolemic shock is occurring. So in whenever there is a burn injury, it is actually from the capillaries, the plasma of the blood is going to filter out. All right, whatever the liquid portion, the plasma is there, that is going to get filtered from the pores of the capillaries. That will ultimately lead to the increase in the extravascular compartment and a corresponding decrease in the intravascular compartment. So students, whenever there is going to be a decrease in the intravascular compartment, there has to occur a hypovolemic shock. In the upcoming videos, I'll be discussing about the treatment what are given for burn patients. It is mostly intravenous administration of large amount of fluid, that is fluid resuscitation is given to patients of burn. So the first very important complication what is seen in a burn patient, it is the hypovolemic shock, which is the most common cause of an early death in case of a patient of burn. So students, the basic cause being since there is a decrease in the intravascular compartment. Moving on to the next very important question what are frequently asked, that is the septic what is the cause of a late death if a person of a burn, if a patient or a victim of a burn is even surviving for a longer period, and when looking at the most common cause for a patient who of a burn, that is the most common cause of late death in a patient of burn, it is actually the septic shock. So as to what is a septic shock? Septic shock mostly occurs whenever there occurs an infection. Mostly it is seen that after the burn, whenever the burn occurs to a patient, after some time, if it is a prolonged period, mostly the various kinds of bacterial infections occur. So those bacterial infections, they will ultimately produce toxins and it will cause bacteremia, toxemia. So that leads to the giving a patient to be having a septic shock. So the most common cause of an early death in a burn patient, it is a hypovolemic shock, and the most common cause for the late death in a burn patient, it is the septic shock. So these are the two very important and most frequently asked questions in the different PG entrance examinations. So students, this was the third point what I have discussed. Moving on to the next very important complication for a burn patient, it is the circulatory changes. So circulatory changes, what are being observed, it is that already I have told you, in the patients of burn, whenever there a severe burn occurs, what it is going to do is the capillaries, the blood capillaries, what are there in the body, in that particular area, there is an increased capillary permeability. So there is a leakage of fluid from the capillaries. So the fluids are going to exude their plasma. There occurs a leakage of fluid from the blood, from the intravascular compartment to the extravascular compartment. So students, the plasma is going to filter out from the tiny pores of the capillaries and it is going to get accumulated within the extracellular tissue fluid, the extracellular compartment, or the ECF. It is going to get accumulated in the extracellular tissue fluid. It is going to accumulate. So this will give rise to an edema. There's going to occur an edema. So the circulatory changes what are seen is there, since there is an increase in the capillary permeability. In the patients of burn, the capillary permeability is going to increase. So that will ultimately lead to the shift of the fluid from the IVC, that is the intravascular compartment, to the extravascular compartment. So since the fluid is escaping from the intravascular compartment, from the capillaries of the blood vessels, so ultimately it is going to cause hypovolemia. As a result, the blood volume is going to fall down, and since the fluid is escaping from the blood capillaries to the extravascular compartment, so in the extravascular compartment there is lots and lots of fluid accumulation that is ultimately going to cause edema. So the patients of burn, they are going to suffer from an edema also. Moving on to the next very important complication, what is seen is immunity. So in patients of burns, what the level of immunity, what is most which falls, it is the cell mediated immunity. There is a decrease in cell mediated immunity what is found in patients of burn, particularly the T lymphocytes and the B lymphocytes, which impart the cell mediated immunity, that it falls down. Moving on to the another very striking and the most important MCQ, the most frequently asked question is about the infections. So then, patients of burn, what are the typical infections and what are the causative organisms which affect the patients of burn? So students, do remember, if whenever talking of the infections what are occurring, the Pseudomonas aeruginosa, do remember this bacteria, that is Pseudomonas aeruginosa. It is the most common bacterial infection what occurs in the patients of burn. So the Pseudomonas infection, it is the most common type of infection what is seen in the patients of burn. Do remember students, the next important bacterial infections in patients of burn includes the Staphylococcus aureus infections and the candidal infections. So these are the three types of infections what are mostly seen in the patients of burns. Moving on to the next important complication, that is the kidney. how the patients of burn, how their kidney functions are going to get impaired, or how their kidney functions is going to get altered. So students, as I have already told you, that since there is a leakage of blood plasma from the capillaries to the extravascular compartment, so ultimately what is going to happen is there is the blood which is flowing in the capillaries, the blood volume, the blood is going to get more concentrated. So when the entire the plasma is being continuously evading out from the tiny holes of the capillaries, the blood is flowing in the capillaries, it is going to get more and more concentrated. So ultimately, there is going to occur an ischemia in the end organs. So whenever it can be the renal artery, the renal venules, the renal capillaries, they are going to have a lesser blood flow, a lesser supply to the blood, and that too a concentrated blood is reaching them. So it ultimately leads to acute tubular damage. So acute tubular damage is going to occur at the level of the kidneys. So that is, the kidney is suffering from an ischemia due to a highly concentrated blood. The blood volume has reduced. So due to an ischemia, the kidney is going to suffer from acute tubular damage since there is a decreased blood supply to the kidney. Moving on to the next very important complication, what we can see, it is the gastrointestinal troubles, gastrointestinal complications, that is the GIT complications. Since there is again already I have mentioned, explained the pathophysiology, that since there is the blood in the intravascular compartment is having a more concentration due to plasma evading out, the blood in the blood flow, the blood capillaries, the blood vessels, it is in a more concentrated form. So ultimately there is a decreased blood supply to the gastrointestinal tract as well, and that will ultimately lead to ulcerations. So students, this was another very important complications what is seen in the patients of burn. Next important complications when looking at is the hypoxia. So students, do remember, whenever there occurs a burn, so the patient is mostly the tissues, at the tissue level, the body is going to suffer from hypoxia. So hypoxia can also be seen due to, first, whenever there is an injury to the respiratory epithelium. So students, do remember, so the hypoxia, when looking at the causes for hypoxia, we find whenever there is an injury to the respiratory epithelium. So the respiratory epithelium, when in severe burn cases, whenever there is a lot of fire everywhere and the victim is being caught in that condition of fire, so obviously it is going to happen that the respiratory epithelium, it is going to get injured due to inhalation of large amount of gases and smoke. So there occurs an injury to the respiratory epithelium, and this injury to the respiratory epithelium is going to lead to laryngeal edema. So ultimately laryngeal edema will occur, and that will lead to the blockage of the airway. So students, do remember, the hypoxia, what is seen in the patients of burn, it is due to the injury to the respiratory epithelium due to inhalation of carbon monoxide, smoke, and other types of gases what gases the victims are trapped in. The next very important complication, the causes for hypoxia in burn patient comprises of, that is the inhalation of soot particles. So whenever there is a massive fire or burns in a particular fire in a particular place, so the victims who are trapped in that scenario, they are going to inhale a large amount of soot particles. So the inhalation of soot particles can also lead to hypoxia in patients of burn. Moving on to the third very important cause for hypoxia, it is the carbon monoxide poisoning. So students, whenever the victims who are trapped in severe fire and everything, what happens is there is production of large amount of carbon monoxide at the sites and the places where the burn is occurring. So the carbon monoxide, as we already know, it is having a higher affinity towards hemoglobin. It is found that the carbon monoxide has a affinity 240 times greater than as compared to oxygen. to the hemoglobin. So the carbon monoxide is going to bind to the hemoglobin of the blood more efficiently, that is 240 times it is having a greater affinity for the hemoglobin. So that will ultimately lead to tissue hypoxia. So students, in such a condition, the treatment is administration of 100% oxygen. So students, just a short review as to what I have explained in the pathophysiology of the burn. Firstly, in the case patients of burn, there is an increased leakage of fluid from the capillaries. This is clear. So from the intravascular compartment, there is leakage of the blood plasma into the extracellular fluid or the tissue fluid. So increased leakage of fluid from the capillaries, that will lead to tissue edema. Since that the plasma is going to get accumulated in the extracellular fluid, that will lead to tissue edema, and ultimately when that entire plasma of the blood is getting filtered out so rapidly, so that will ultimately lead to the concentration of blood, that in turn leads to a poor blood flow. So when the blood is going to get concentrated, the blood flow to the different organs, particularly the kidney and the gastrointestinal tract, it is going to these organs of the body are going to receive a lesser amount of blood flow. That is, a poorer blood flow occurs over there, and that can ultimately lead to renal failure and stomach ulcers. So students, do remember, this was the entire pathophysiology as to how there is occurring liver failure and stomach ulcers in patients of burns. Now, another very important and the most frequently asked MCQs in the competitive exams is about the burn, the ulcers what are found in burns. So students, do remember the mnemonic as to how we can very easily remember and not get confused with the two types of ulcers, that is the Curling's ulcer and the Cushing's ulcer. So students, mostly students get confused when asked about what types of ulcers are seen in the gastrointestinal tract or in the stomach. Students, they mostly get confused, and they take, in place of Curling's, they are mostly marking Cushing's ulcer as their option, which is absolutely wrong. So students, just look at the word. In the cases of burn, the ulcers what are formed in the stomach, they are the Curling's ulcer. So you do remember the word BURN. So UR of the burn is referring to the UR of the Curling. So BURN is burn. So UR is found over the UR alphabets are found over here. So the ulcer what are found, what the name these ulcers have got in burn patient, it is the Curling's ulcer, that is the CUR. So UR of the Curling and UR of the burn will help you to easily remember as to what is the name given to the ulcers what are formed in a burns patient. So in the patients of burn, the stomach ulcers what are formed, it is the Curling's ulcer what are seen in the patients of burn. And students, don't get confused with this another ulcer, that is the Cushing's ulcer. So the Cushing's ulcer is having a different mnemonic. So just remember, Cushing's ulcer is having an H in it. That is, the H of the Cushing is going to refer to the H of the head injury. So students out there, do remember, whenever it is a Cushing's ulcer, so Cushing's ulcer is seen during an injury to a head, the H of the Cushing is going to correspond to the H of the head injury. So student, this is the short trick as to how we can very easily remember what is the name given to the ulcer whenever an head injury is occurring, and what is the name given to the ulcer in the stomach in the patients of burn. So the UR of the burn is referring to the UR of the Curling's. So the burn, in the patients of burn, the Curling's ulcer are seen in the stomach, and in the patients of head injury, the Cushing's ulcer is seen, where H of the Cushing's you can make out the H refers to the head. So the Cushing's ulcer is seen in the patients of head injury. So students, this was my discussion about the complications what are seen in the patients of burn. So student, do remember, don't if you do like my video, don't forget to subscribe my channel and do press the bell icon so that you can be further updated about my newer videos. Thank you for watching.